Good afternoon, everybody, and welcome to today's webinar about health and safety in the home. I'm sure lots of people are working from home in a way they never have before, and it's quite an uncertain time for everyone. So shortly, I'll be handing over to my colleagues Shelly Asquith and Quinn Roache, and they'll be talking you through these aspects for a few minutes before we'll try and take some of your questions. So on this side of the screen, there's a chat panel, and it's great to see so many of you already introducing yourselves. So please post there, say where you're from and a bit about yourself. And underneath the screen, there's an ask a question box. That's where you can post your questions to Shelly and to Quinn, and we'll try and get to them afterwards. So first of all, I'm going to hand over to Shelly, and she's going to talk to us about health and safety and working from home. So Shelly, over to you.
Thanks, Anna. Hi, everyone that's tuned in today. So, of course, many of us in this current context of the coronavirus crisis are working from home, myself included. And while some people might be used to it, for others, it will be a completely new thing. And just because it's your home and it's an environment that you're familiar with and you're ultimately responsible for, it doesn't mean that there aren't health and safety issues to consider. So ordinarily, we would recommend employers carry out an assessment of the home working environment before an employee begins working from home, and workers would have the right to invite a union health and safety rep to carry out an inspection of their home. But that's obviously not possible in these circumstances. But an assessment can still be carried out, and we would encourage unions to ask employers that those be done by the person working from home individually. Now, the Health and Safety Executive has produced a model checklist which could be used or even adapted depending on your workplace or your environment, which is specifically for home workers making regular use of a computer screen. Now, I appreciate not everybody that's working from home has their eyes glued to a computer all day long, but for most of us that is the case. And it should include practical matters such as the layout of a workstation, for example, your seating, eye level of monitor, where a computer is being used, as well as issues like ensuring work doesn't disrupt the home life outside of work hours. And ergonomics, I have to stress, is such a key thing to consider because repetitive strain injury is largely a work-related illness. If colleagues don't have a decent standard of office chair at home, there are things that can be purchased to support posture in an ordinary chair, things like cushioning. And you want to make sure you've got lower back support for your feet. The ideal position, safety researchers and experts say, is for you to have straight wrists when you're typing, with arms and legs at a 90-degree angle, and your screen about an arm's length away at eye level, so you're not kind of straining over or looking up, so you're kind of supporting your shoulders and your neck when you're looking at a screen. And you can elevate a screen using a stand that can be purchased or even using books, but that only really works if you've got a separate keyboard. So you don't want to be kind of, it's hard to see what I'm doing, but straining your wrist essentially. For any equipment that colleagues might be buying, unions should put it to management that they will be fully reimbursed. We don't want anybody being worse off financially as a result of looking after their own health and safety. That wouldn't be the case in an ordinary workplace, and it shouldn't be the case working from home either. Negotiating for a specific pot of money that is especially reserved for these things will help encourage people to expense it. Otherwise, if there's an understanding that the costs for buying certain equipment will be coming from their department budget or something similar, people may be less inclined to claim from it because there might be fear of repercussions if they do. So colleagues should be encouraged to do other things as well, like walking away from a screen regularly to reduce static working. Around 10 minutes each hour away from screen time is recommended. Obviously, when you're in an office with lots of people around, it's much more usual for you to be getting up, going and talking to people. But when we're working from home in isolation, it can be quite easy to forget to kind of actually take our eyes off the screen and walk around for a little bit. One example is you could just walk around every time you get a phone call. But the main kind of hazards to safeguard against are, as I mentioned, kind of harm to your health from poor workstation layout, working position or conditions. But there are other things that unions should include in those assessments, things like injury resulting from tripping over cables or other obstructions on the floor, something definitely to bear in mind for parents who might be looking after kids. Injury from using damaged or unsuitable equipment, that might be where the employer has already issued you with equipment to take home, or it might be using your own. Injury to the employee or others arising from the presence or actions of others. So again, that includes children. And if you're working from a home in a non-office type setting, for example, I'm sat here in my kitchen, there will be other hazards which are all kind of dependent on the worker's environment. So these will differ depending on where people are working for and what their home is like. We recommend that union reps ask employers to produce some guidance on working from home. That could be a full-length policy, or it could be, something really brief. But it should include guidance on use of personal equipment, including on data protection and insurance where workers are handling sensitive and personal information. We don't want anybody facing any repercussions. Now, union reps should make colleagues aware that their home insurance policies, terms and conditions, where people have them, may change if they're working from home. And in particular, they may be liable to an increase in their insurance premium if they've not declared that they're going to be working from home for a lengthy period of time. So something to flag. We know what insurance companies can be like. And there is best practice in terms of claiming equipment and claiming costs of things like Wi-Fi and so on. For example, at Bristol City Council, they also recompensate workers for any increase in their insurance premiums as well. So that is a good case study, and you can look at their working from home policy actually on the TUC's website. Advice from employers should also include guidance on what to do if equipment becomes faulty. And I know there were a couple of questions that came in on this. It won't be possible in most cases for computers to be serviced, of course, and it might not be possible for employers to supply replacements. But nobody should incur a loss of pay because of faulty or substantial equipment. If that means they can't do their job, it's no fault of their own, and therefore they shouldn't be at detriment. So that was a little bit of an overview of the kind of things you could be looking at in terms of getting your employer to carry out an assessment for colleagues that are working from home. I'm going to hand over now to my colleague Quinn, who's going to talk you through reasonable adjustments and disability. Hi, Quinn.
Hi, I just want to check before I start that you can hear me.
Yep, loud and clear. Over to you, Quinn.
Fantastic. So before I start getting into the sort of meat of this topic, what I want to do is talk to you a bit about the scene around what's happening to disabled workers at work. So what we know from our analysis is that disabled people face double discrimination. They're less likely to be in work, and when they are in work, they are paid less. So only around 50% of disabled workers of working age are employed compared to 80% of non-disabled people. And they're paid roughly 15.5% less, which is equivalent to £3,000 a year less. Or it means that disabled workers work for 2 months of each year for free. So not only that, but government research tells us that disabled people are more likely to fall out of work than non-disabled people. So it's really not surprising that we know that one of the most common issues reps deal with is disability discrimination. And what our members tell us is that one of the most common issues they face is getting and keeping in place their reasonable adjustments. And those are the things they need to do their jobs. So now we're in a once-in-a-century event, and more people than ever are working from home. And this has unsurprisingly thrown up concerns from reps and members about their reasonable adjustments. So what I'm going to try and do is answer some of the most common questions we've had before Shelly and I take questions at the end of this. Now, one question I've had a couple of times is, has the law changed around reasonable adjustments? And the law has not changed. It's set out in the Equality Act 2010, and it says that employers have a duty to make reasonable adjustments for disabled workers. So employers need to ask themselves whether the way they do things, the physical features of their workplace, or the absence of auxiliary aids or services is putting disabled members at a substantial disadvantage when compared with non-disabled workers. And this duty includes when working from home. So what I'm really trying to say is that existing reasonable adjustments, i.e. those that were established before the coronavirus crisis, still apply and should be kept in place, and new requirements for reasonable adjustments, so those that may have arisen as a result from working from home or other working arrangements as a result of the crisis, should be put in place. Now, That is said, the pandemic has not changed the law, but it might impact on what is considered reasonable. So while the laws stay the same, the efforts an employment tribunal will consider sufficient to discharge an employer's duty under the law is unclear in some circumstances. So for some requests, what is reasonable will be unaffected. So for example, a request to put in place a piece of software that can be remotely installed, that will be fine, and that is within what we would expect, and employers should be doing that. However, what is reasonable is more complex, specifically when considering requests that require some installation of a specialist product in the home by another person. So within that context, it's unlikely an employment tribunal would expect an employer to have that equipment installed. So in these instances, health and safety and reasonable adjustments, they kind of come into conflict, and I would anticipate health and safety might outweigh the duty in this instance. So when an employer puts in place the reasonable adjustments their member needs, or if an employer is unable to put in place the adjustments a member needs, we think that reps should consider asking that those members are temporarily reassigned or given other work duties that they can do until they're able to get the full adjustments they need. And a rep who encounters these issues should really seek advice from their head office on how to proceed. But that's kind of one of the changes that are currently bubbling up. Another one of the questions we have had are, what are some of the working from home adjustments members could request? And I'll start just by pointing out that there is no one-size-fits-all reasonable adjustments. Every member and their needs are specific and unique. So the first point of call is always to talk to your member about what they need to be put in place. That said, there are some common adjustments we have been told are being helpful. And those include sort of changing work hours or standard meeting times, and when they're scheduled within the day, ensuring that specialist equipment is in place, and installing that kind of software that you would anticipate you need on your computer if you're computer-based. And the other thing to highlight is that we know that for many members, this is a really new experience, and that for a long time, they've been denied working from home rights. And what this means is that for disabled members, some of the adjustments they had in place when they were working in the office no longer are effective. So reps might be asked or approached by the members to talk about new adjustments, and they should certainly be encouraged to request new adjustments from their employer. But before doing this, we would advise that the member and yourself consider the impact of the working conditions on them, given their personal circumstances, the barriers that they are encountering, and what they think would make it easier for them to do their job. And it's also good practice when sort of renegotiating or negotiating for reasonable adjustments to record them. And the TUC, we've produced a disability reasonable adjustments passport, and there should be a link coming up. And that is a really good document for helping to record the agreed adjustments that you have put in place. Another question we've had quite a number of times is what reasonable adjustments could be put in place to support disabled members to communicate with their colleagues. So again, there is no one-size-fits-all reasonable adjustment, and each member is unique, so you should talk to them about what they need. But really, with most of us now kind of working from home, the main methods of communication are either via video or phone conference. And there are adjustments that can be put in place to make sure your members' needs are met. So this usually requires a bit of forethought on the employer's part, but it could be using things like a speech-to-text provider or providing a specialist phone. And it's even possible with enough notice to get a BSL interpreter to join video conference meetings. So members might be coming across difficulties in communication, but with your help, there are things that the employer can put in place to make sure that they're able to communicate effectively with their employees and workers. And finally, another question which is quite common is that the employer has suggested they furlough disabled members because the employer does not want to put in place the reasonable adjustments the member needs. And can employers do that? So an employer who furloughs a disabled member because they do not want to put in place the reasonable adjustments, in effect, is breaching the equality legislation. And they could be taken to an employment tribunal on the grounds of disability discrimination. But there's a really good blog by my colleague, Tim Sharp, who's a senior policy officer. And he, if you could, I'm sure the link will come up, if you could read that, that will also kind of aid you a bit. And now I think I'll hand back to Anna.
Thanks, Quinn. Right, we're going to see how many questions we can get through that have come in. I can't promise we'll get to all of them, but we'll try our best. So I think the first question might be more for Shelly, but if I'm wrong, Quinn, do dive in. So Joanne has asked what responsibility the employer has for health and safety at home, but specifically around stress, rather than some of the other things we've already discussed. And the example she cites is because children are off school. If children are around all day, how does that work? How can things be balanced? Right, we're just waiting for Shelly to reconnect.
Can I just
sorry,
come in here? That was sure. That was a question about stress, and it linked to people working from home and parents having to care for children. Is that? I just want to make sure I'm on the.
Absolutely, yeah. Go for it. How the employer's responsibility for health and safety at home, with particularly regard to stress, and the example that she used was because children are around because they're not at school.
Yeah. Okay. So I think it's more. I'll take this from kind of a mental health kind of angle. So we know that a lot of employers have poor practice in relation to mental health in the workplace, and what's important for us as a trade union movement to do is to realize that we should be really trying to address that collectively as a group, rather than letting people kind of pick it off one by one. So there's a really great document that's been produced by the TUC. I think it's called Mental Health at Work. And what it does is it takes everyone through kind of step-by-step the things that they can be asking for. And what it does really effectively is it highlights those employer-led programs which are kind of bogus. So what we need to do in these instances is change employer practice, not change people. So it calls out things like early morning yoga or resilience-led programs. What we should be doing is supporting our workers, our members, rather than trying to, and not trying to change them, but to change the workplace.
Thanks, Quinn. We've just managed to get Shelly back. Don't know how much of that you heard, Shelly, but if you want to add anything, go for it.
Yeah, I heard it all. I was going to contribute more generally on mental health and stress while working from home. I don't know if you want me to come in more broadly on that. In terms of the response to the question, though, so the responsibilities the employer has on health and safety at home, specifically around stress, well, absolutely there is a responsibility on not creating hazards at work. Home is the workplace now, and hazards is a stress, and stress is a hazard rather. And it's kind of horrible to hear people writing in saying that they're expected to look after their children all day and then work in the evening and not kind of have any personal time whatsoever. And it sounds like management hasn't considered the implications of that at all. So I would say that the workplace union should be making representations immediately around introducing flexibility, particularly for workers who are affected by the school closures, and supporting them to take parental leave where that's available. And I definitely think in this instance that was highlighted in the question that there could be secondary discrimination here against workers with caring responsibilities. And I think that's obviously one that's overwhelmingly going to fall on women workers. So union reps should remind employers of that. Anna, did you want me to come in more generally on mental health stuff?
Yes, please.
Yeah, okay, cool. So just to give a background in terms of like legislation, the law states that employers have to try to remove or reduce stress as far as is reasonably practical under Section 2 of the Health and Safety at Work Act 1974. Employers have a general duty of care to ensure the health, safety and welfare of all their employees, and this absolutely includes your mental health. And work-related stress should be treated as any kind of other workplace hazard. There are some key areas which we identify as causes of workplace stress, and that includes certain demands, things around workloads, work patterns and the work environment, control, how much say does the person have in the way that they do their work, support, so the encouragement and resources that are provided by your employer, by your line manager and by your colleagues, relationships, and that includes promoting positive working to avoid conflict and dealing with unacceptable behaviour in the workplace. Your role, so whether you understand the role within your organisation, whether the organisation ensures that colleagues don't have conflicting roles. And finally, change, how organisational change, whether that's small things or big things, is managed and communicated throughout the organisation. Now, many of these things are things that could be in flux right now, especially around change and demands, as people could either have much more work to do in the current context or much less. And changes could be being made around putting people on furlough, redeployment, a whole range of different things that could be incredibly stressful. And union reps need to ensure that they have a voice in discussions around what is changing and how workloads are being allocated. We've published some joint guidance with the Health and Safety Executive on tackling workplace stress in general, and the indicators that can be used to ensure that those key areas that I mentioned are being addressed, and that is all still completely relevant in a working from home context. An important thing that I also want to stress is that as trade unionists, our focus is on changing the workplace and the work culture, not on changing the worker. Management practices have in recent years focused on resilience and well-being, which really problematizes the individual and somebody who needs to just toughen up and become more resilient to your stressful environment. What we want is for work to change so that it's less stressful, and that there is more management support for workers to go about their jobs healthily and happily without having to navigate stressful environments. Now, there are obviously steps that all of us can take to support our own personal mental well-being during this crisis, and there is no shortage of advice on that from various mental health organisations, things like getting up at regular times, taking exercise, phoning friends and family. But what we obviously focus on is how trade unions can get the support we need for workers in a work context. So if employers have an existing mental health policy, union reps should currently be suggesting that that's reassessed according to the current context of everybody working from home, or indeed lots of people working from home. And it should be emphasised that mental health concerns are a valid sickness absence, as they always have been, and that during this period of self-isolation, obtaining a doctor's note where necessary should be done online, or where possible, employers should allow for personal declaration. Union reps, again, have an important role to play in ensuring that no worker suffers detriment, whether that be through a pay cut or disciplinary, as a result of having to take time off for mental health concerns, and that occupational sick pay, where it applies, is still paid. As well as the obvious things around isolation and loneliness as a result of working from home, bosses also need to be mindful that the coronavirus itself is a stressor. Colleagues may be concerned about their own health, about the health of loved ones, or they might even be directly affected. So union reps should ensure that there is adequate signposting available, and think about how policies can be supported with information about getting support for bereavement and ensuring people have access to paid compassionate leave in case they need it. There are other things to include in a policy that will relate to the mental health of colleagues working from home. For example, bosses should be ensuring that all workers understand their duties while working from home, and that working hours, as much as possible, are still being followed. They should also take steps to ensure people can take regular meal breaks and rest breaks, and be flexible with this as well, because a lot of us are now having to take the time to prepare meals as well as eating them, which we wouldn't ordinarily do. And those personal steps I mentioned before that we can all kind of take to improve our well-being are only possible if we have that personal time away from work. So it's important that those working hours are clear and are defined, so that colleagues have that work-life separation still, despite being in their own home. And where people are trying to juggle working from home while caring for children off school, as I said before, appropriate flexibility should be offered without any loss of pay. And I just want to say something about isolation. So union reps should be mindful that working in isolation can not only affect our mental health, but it can also be exploited by bosses by trying to avoid keeping people informed, avoid workers talking to each other and organising collectively, essentially. So this is where unions can step in and play a role in bringing people together, not only to kind of address that isolation aspect, but to discuss working conditions and collective demands. I'm now going to post a link to the TUC's mental health workbook, which has loads of information, much of which is still relevant regardless of people's working locations. And just as a finishing note, while some employers have previously welcomed working from home, others have been a lot more hostile to it. And I think home working as an option where it's done right is actually really positive and should be encouraged. And I suspect that once this crisis is over, we may see a rise in the number of people working from home, having kind of proven how possible it is. And that makes this stuff even more important, as trade unionists may need to continue negotiating on behalf of colleagues in the long term around working from home and the kind of reasonable adjustments and things that bosses should be thinking about. And that may even involve resisting any moves to force people to start working from home in the long term, as a cost-saving exercise or whatever the other reasons might be, where people might not want to keep doing this for the rest of their working lives. Back to you, Anna.
Thanks, Shelley. You covered an awful lot there, and you've managed to answer a lot of the questions that have been posted, so that's brilliant. We've got one now that I think is for Quinn. Where do we stand with disabilities that have never been reported before because the workplace was completely okay, but that's not the case when someone's working from home?
Where do we stand? I think that the members should be reporting it to their manager and talking about the adjustments that they need to be put in place. So the TUC, we've adopted the social model of disability rather than the medical model, which is outlined within the Equality 2010 Act. But I think regardless, if a person is disabled and they now need an adjustment and they're working from home, that they should be talking to their line manager and possibly talking to their rep first about what they need and trying to get that put in place.
Thanks, Quinn. Question for Shelley. The vast majority of Blaze's members are using laptops while they're working from home. How does this fit in with the arm's length recommendation, this measurement thing?
Yeah, it's a good question. Where possible, union reps should be asking employers to make available separate keyboards and reimbursing people so that you can have your keyboard elevated so that it's at that right, not only the length away from you, but also at the right eye level. I've currently got mine stacked up on books, but it does mean that the keyboard is really far away from me. So having a separate keyboard is important there. And as I said before, I think arguing for a separate fund allocated for these extra equipment resources is really important so that people feel that they're able to claim against it.
Okay, we've had a question from Rachel saying, could someone apply for an access to work grant if the employer refuses to supply or deliver adapted equipment that they usually use in the office?
I'm not sure about that. The access to work grant, that'd be one that we'd have to look at and get back to Rachel, I think.
Okay.
What the specificities are.
Yeah, that's great. Just to let everyone know, if we don't answer your question specifically, or if it's something we need to check, we do use all of these questions to frame the blogs and the guidance and the information that we put out on our website, on our social media channels. Every question is important, even though we might not answer it directly. Right, just 1 second. I'm just seeing what other questions we've had. So we've talked a little bit about mental health, but do we have any more specific information about employers' duty of care to all employees to safeguard their mental health, specifically because they're working from home, and that may cause other particular situations to arise?
Yeah, well, they absolutely have a duty of care to look after people's mental health, and I guess it's around unions reminding them of that, reminding them of the law, and pointing them to the information from the Health and Safety Executive, the information from us around what kind of steps can be taken to safeguard that. It is a really remarkable situation that we're operating in, and as I said, the actual crisis itself is a stressor for a lot of people, and I think we just need to make sure that union reps feel confident in reminding employers of that, and ensuring that there is as much flexibility offered to workers as possible in terms of their hours, in terms of their output as well.
Yeah, and just to kind of add a bit onto that as well. So, there are disabled workers who have poor mental health as a disability, and the employer, this pandemic that we're in, this crisis, is affecting them as well. And there are reasonable adjustments that the employer should be putting in place or keeping in place to help those individuals stay in work. And usually the best practice would be for, the reasonable adjustments to be led by the member. So I won't kind of list different reasonable adjustments that are there, but, we could do I could give some examples if they would be useful later on.
Thanks, Quinn. We've had quite a large number of questions about equipment for working from home and costs. And I know you mentioned it in your original presentation, Shelly, but there are people asking about what could the union role be in getting employers to pay for additional equipment that might be bought. What other strategies can reps use for this, and what is the minimum that they can be expecting employers to pay for?
Well, the minimum has to be based on the requirement of employers to safeguard workers' health and safety. So if they're putting people at risk by forcing them to use equipment that just isn't up to standard, they're putting their health and safety at risk. They're putting them at risk of developing repetitive strain injury and things like that, as I mentioned. So that is the ultimate thing that union reps have to remind them of. If employers are still resisting paying up for these things, then I would consider escalating your organising. Think about doing an open letter. Think about shaming the employer if they really are kind of being tight about it and forcing you to use things that aren't up to standard. And getting in touch with your union centrally and asking for what kind of advice there is around that. I think it's only reasonable that people are expected to buy their own equipment if they're promised that it's going to be reimbursed at a later date. So trying to make sure that your colleagues aren't buying lots of very expensive things without that commitment from bosses to pay it back, I think is really important. We don't want people to be out of pocket, but we also don't want them to be at harm.
Thanks, Shelley. We've had a query from, I think it's from Magdalena, asking about advice on the increase in domestic abuse at this time. I'm not going to pose this question to Quinn or Shelley, but just to let you know that the TUC is going to be publishing something about that very soon, so keep a lookout for it. That is something we're working on because we are very aware that this is an increasing issue. What about, we've had a question that relates specifically to teaching staff who are having to undertake a huge learning curve themselves to deliver online learning to their pupils. But this is perhaps leading to increased mental stress. Is this something that the union can advise on or help out with? So it's use of new equipment and new methods of doing their job because of this situation.
Yeah, well, unions, for a start, should be asking employers to provide adequate training on these new equipments and new ways of teaching. And if that's not being carried out, then people shouldn't be expected to use it, frankly. And And I think that, again, unions might want to raise issues around flexibility. I know that in lots of universities, for example, deadlines have been extended, and that's not just in the interest of students who are suddenly in flux and gone back to home countries and so on, but actually it's also about giving members of staff that amount of time to get to grips with new technology and new ways of teaching before they then have to be burdened with marking and assessment. So things like that can be considered, but certainly I think the teaching unions will have more thorough advice and guidance on that. I actually saw another question come in from somebody who's clearly a teacher or working in online learning at the moment around removing personal home views when using things like Zoom or Skype. So I know Zoom does offer personalized backdrops. I think I was in a call with you, Anna, before, where you looked like you were in San Francisco. So that's something to think about. If you're talking to students or colleagues or any members of the public or whatever, that you might not want them to have an eye into your personal home life. Skype also offers blurring of the background. But if these things aren't possible, if you're using a different program that doesn't offer that, then I would say that unions could reasonably ask employers to provide backdrops, things like green screens that could be put up behind, these sorts of things that obscure the view and give you that privacy when you're still working from home.
Thanks, Shelley. That's lots of useful information. Right, I'm just bear with me. I'm just looking down the list of questions. We've covered quite a lot of them. And yeah, there are quite a lot of questions that have come in asking about whether you'll be able to view this webinar afterwards. Absolutely, we'll be sending a link to a recording of it on YouTube later today, and all of the resources that Shelley and Quinn have mentioned, we'll be including those as well. So any policies or guidance that we've already mentioned, we will be including. Okay, maybe we've got time for one last question. If someone cannot work safely at home due to lack of equipment, for example, no desk or table, where does the person stand if they refuse to work?
That is a really good question, and it doesn't just relate to people working from home in unsafe conditions. It relates to people who are still going into warehouses and factories where there's no distancing. So that's a question that is really, really relevant to the current crisis in so many ways. There are laws that protect you, for example, Section 44 of the Health and Safety Act and other bits of legislation. I would definitely recommend speaking to your union's legal team and asking their advice. You absolutely have protection to refuse to carry out work if you feel that you're at harm and your safety is being compromised, but do make sure you've got your union behind you before doing that, and do speak to your union reps as well, because you're probably not the only person in that position. There may well be others who are in that position, and you're always safer organising and acting collectively.
Thanks, Shelley. What's really great to see is that over in the chat panel is that people are sharing links from their union or other resources that they think will be helpful. I can see some information from the NEU, also from the NASUWT. I think that was in reference to the teaching example that Shelley was talking about. So yeah, please do go back and take a look at that. Okay, before we wrap up, I can hand back to Shelley and Quinn just to say a couple of last words. Quinn, do you want to go first?
Just to say, it's been this has been my first webinar, and it's been great. Hopefully what I said made sense, but there will be a blog coming out which kind of encapsulates all the advice we have on reasonable adjustments during the COVID crisis, and that should be out either this week or early next. So do kind of look out for it. And if your workplace doesn't have a disability reasonable adjustments passport, please have a look at the one that I linked earlier. It's really effective and can really help yourselves and your members. So thanks.
Thanks, Quinn. Shelley?
Yeah, just to say thanks everybody for tuning in. Please, as I say, contact your union if you've got any specific concerns around your own sector and your own modes of working. Please come back next week for our next webinar, and feel free to get in touch with colleagues at the TUC and in your unions about any further issues that you have, and we'll do our best to answer any questions that we haven't managed to answer today.
Thanks, guys. Like Shelly says, we'll be doing a webinar again next week. I think it's next Thursday. The date of that will be April the 16th, so after the Easter break. We'll be advertising it soon, so please do sign up when you see the notification. We'll see you next week. Stay safe over the weekend, and we'll see you again soon. Bye-bye.